So this would be a good time to go ahead and do your hand hygiene again, if you didn't before. Make sure you have your mask on. And again, I'm going to leave mine off just for the demonstration purposes, but make sure you have your mask on. Make sure the patient's mask is on. You only need clean gloves for this. However, you're getting ready to expose sterile parts. So when you make your sterile connection, that's why you need your mask on. Okay, so your mask is on. It says check patient line, and that's just making sure that this line is open. You're going to pull this off. If you haven't done so already, you can take your tape off. Your patient's transfer set should be sitting out on their lap. The transfer twist clamp is closed. So you want to make sure you hold your patient's transfer set in your fist with your fingers over your thumb. You've got your patient connector in your fist with your thumb behind your patient, the lip of your patient connector. You're going to use your finger to pull the cap off, untwist the mini cap, drop it, and make your sterile connection and twist it until you can't twist it anymore. Okay? At this point, this is probably going to have some betadine residue on it, so you can get your bleach wipes and wipe that residue off. Then you take and open your twist clamp. Holding it by the light blue part, you just twist open the white part. And you're finished with making your connection. You want to go forward to the next step, so you hit the go button. Verify initial drain. Just for demonstration purposes, we have 10 mLs, but that may be a larger number when you're actually doing your therapy. You're going to hit go. Please wait. And the machine always starts in drain. When you're talking about peritoneal dialysis, there's always 3 steps: drain, fill, and dwell. And you will always start in drain. So the machine is going to drain the old fluid out. It will fill, and that's when you start your first cycle. With the fill, it'll dwell for a period of time, and then it'll drain the next cycle and start the next cycle with fill. So with the machine, with the cycler, what you can do is you can look into the prescription, and in the physician's order, it'll read a therapy volume. So that is the total number of liters that in this particular session is going to go in and out of a patient. So for example, a 15,000 milliliter or 15 liter therapy volume. And then the fill volume is the amount of fluid that will go in at one time. So that would be the amount of fluid that you need to use per exchange. And then the prescription will read how many hours. It could be 8 hours, it could be 10 hours. Some patients have a 24-hour therapy time. So you have your therapy volume, your fill volume, and your therapy time. It's saying check patient line. So we're going to hit go. So it's still in the initial drain. And the initial drain alarm that we had there, that you had the previous 10 mLs, what that means is that the machine is expecting, based on what the previous fill was, how much it thinks it should come out. So when you're documenting an epic, two things come into play. It's your initial drain and your total UF. So with your initial drain, that's the amount of effluent that is coming out of the patient at the very beginning of the therapy. And there's a place in Epic to document that. And then the total UF is the total amount of fluid that has come out of the patient during the cycling time minus the amount of fluid that it puts in. So for example, if you tell the machine that you're using a therapy volume of 15,000 and the machine drains out 16,000 during the therapy, your total UF will be 1,000. Okay, so some questions that might be popping up at this point is where we are in the initial drain. It goes into fill 1 of 1, okay? You can press the arrow down. It's going to tell you how much of your fill volume. The initial drain volume, we drained out 93 milliliters. Your total UF, we don't have that yet. And review program. So we're going to hit, if you hit the down button again, this is the current time, and it'll tell you it'll finish at 4 p.m. So if you're wondering what time your patient's going to finish with their therapy, you can come in and just keep scrolling down the down button, and you'll get to where the patient will finish. If you hit the up button, that's the current time. We want to review the program. So we're going to hit our enter button. That's our yes button. Yes, I want to review the program. Our therapy is CCPD, IPD. Our total volume, for the purposes of this demonstration, I made it 200. But if your physician order says 15,000 or 15 liters, you would hit the enter button. It'll flash saying, if it's flashing, you can make a change. And then you hit the up button until you have 1 5 with 3 zeros. That'll be 15 liters, right? So then you hit the down button again, therapy time. For the purposes of this demonstration, I went with 20 minutes. The physician will tell you in the orders what your therapy time will be. So you hit the enter button, it'll flash at you, and then you hit the up button until it says 12 hours. So 12.00 or 12 hours and 30 minutes or 13 hours, whatever the physician, however many hours the physician wants you, or the NP wants you to have this patient connected to the cycler. You don't have to put in a dwell time because the machine automatically calculates that. So then the next question is fill volume. And the answer to that is how much do you want to go into the patient at one time? Typically it's going to be somewhere between 2 and 3 liters. It will never be over 3 liters. The human peritoneal cavity will not hold more than a 3-liter volume, okay? Then you hit the down button and it'll say last fill volume. Some patients may be dry during the day, meaning that they end in a drain. So it could be a last fill volume of 0. That's not very common. Most of the time, there's a fill volume in the patient because when you're talking about peritoneal dialysis, the dialysis occurs when there's dialysis fluid against the peritoneal membrane. So they typically want that. So your last fill volume, though, may be a different amount. Maybe the patient's going for physical therapy. So instead of filling with 3 liters, during the day they want a lesser amount, it might be 2 liters. So, but the physician will write that in their prescription, last fill amount or last fill volume. But that's what you'll put there. And then dextrose. As I said in the beginning, there are 3 types of dextrose. The 1.5%, which is color-coded yellow, 2.5%, which is color-coded green, 4.25%, which is color-coded red. So the 1.5% is the smallest amount of dextrose. If you think about it in trying to manage a patient's fluid, if you sprinkle 1 teaspoon across a bowl of strawberries, you're not going to get a lot of liquid. There's not going to be a lot of syrup. But if you take 4 teaspoons and sprinkle that over of sugar and sprinkle that over a bowl of strawberries, you come back in a little bit, you've got a lot more syrup. You're pulling more fluid out of those strawberries. It's the same kind of principle. The dextrose is what pulls the fluid off of the patient, and then it drains into the patient's drain bag. And the machine will count how much the difference is, and that's called your ultrafiltration. So is the dextrose same or is it different? That will be in your physician's prescription, and if it's the same, then it doesn't matter what bag you place on the blue clamp. But if it's different, then the pharmacy should send you up a different dextrose, and that is the one that you will have connected to the blue clamp. If the physician writes last bag fill, a different type of solution, a different dextrose from your therapy volume. Hit the down button again, and here you can change this to pounds or kilograms. Most nephrologists like the kilograms. Hit the down button again, and you can enter your patient's weight. Some machines, they have a USB port that they will record the data on that, and then there's software that Baxter uses that the patient can actually take that out of the machine to their dialysis unit, and they'll be able to download their records, alarms, and everything through that machine. This machine doesn't have that, but you still have the feature where you can have the patient's weight. And then you use the up button to scroll back up. Kinda. Go back to go. Or stop. Cycle 1. Dwell time. And we're in dwell 1 of 1 in our demonstration. The other question that may pop up is, what if the patient has a cloudy effluent? Anytime the patient has a cloudy effluent, the first thing you have to think is peritonitis, and that is a medical emergency. That is a stop what you're doing. That needs to be dealt with instantly, or as faster than that if you can. So the fluid, when it comes out of the drain bag, you want to make sure that it's clear. But if you have to get a sample on the drain line, this part is your drain sample. You have an effluent sample bag. You can pull this out. This is clean. You might want to put your gloves on just because it's kind of like emptying a urinal. Think of it like that. This is clamped, so So you can pull this off, pull that off, twist it together, and if you open this clamp, it uses gravity. This holds 150 cc's. So if the nephrologist writes for you to collect an effluent sample, you can collect it in this bag. Oh, but wait, what if the patient's not on the cycler? We've thought of that. What you can do is this part on your effluent sample bag also connects onto the transfer set. So you could get the effluent directly from the transfer set before you connect to the cycler. But if you forget, or if during the therapy you need to get a sample of the effluent coming out of the patient, this is a super easy way to do it. You just make that connection, unclamp your line, unclamp this line, and it'll only fill to 150 cc's. You can come back in a little bit and get, this bag will be full. And then you just clamp, clamp, disconnect, and you can use a mini cap to cover the end of your connection. You have a port that if you need to send a cell count, it goes in a purple top tube, just like you're getting it out of an IV bag. You can use your sample, put your tube in, and send it to the lab. If you're sending it for a culture, you could do the same thing. One thing I would recommend is that you send the whole bag, and you can protect the end with a mini cap. A mini cap will fit on the end. Make sure it's clamped, and put that in your lab, in that biohazard bag, and just send the whole thing to the lab, and they'll know what to do with it. So that's how to collect a sample. Another question that might pop up while we're talking about it is the drain bag. The drain bag itself, this will hold over 20 liters of fluid. And it's nearly indestructible. I've had these bags be so full and had a patient weighing over 300 pounds sitting in a chair and accidentally rolled over it while it was full and didn't rip it. So the plastic is very heavy duty, is made to withstand just about anything. But the biggest thing is to make sure that your outlet port is clamped. I promise you'll only forget that one time.